Namaste. Welcome. Today's day 36 of our 45-day series on lasting longer. I hope some of you have seen some good results, and I am here to tell you to stay positive, keep going. You'll know when you see results and you'll know when to stop. Before we get started, just a few friendly reminders. If you like this video, hit that like button. It helps me to push this video out to more people so I may help them. Also, subscribe to our channel and hit that notification bell so when the next day gets released, you're right there with us. And with that, let's get started here today. Well, welcome. Get into a comfortable position. If you're able to do this sequence outside, please do that. The vitamin D can help you to last longer also. I'm not using an acupressure mat or a yoga mat. I'm sitting on the floor, but do what's comfortable for you. This is the start of the next few that are a combination of acupressure and asanas. We have introduced so many acupressure points, and we've also introduced asanas. So starting this sequence, we're going to do a combination of both to help you get the doubling, tripling effect so you can bring blood flow to the pelvic floor so you may last longer. First asana is very simple. You want to do it in a seated position. Bring your feet together. Put the soles of your feet together. And if you can't put your soles of your feet together, then put them as close as you can. This actually brings great openness to the pelvic floor and also helps promote and activate blood flow to the pelvic floor. I'm going to couple it with an asana that is very good for many aspects. It's a great wellness point, and we have introduced this one time and time before, but this one is an oldie but a goodie. And so where you'll want to go is where the forehead meets the hairline, in the middle of the forehead, and you'll go through the third eye, through the nose, to the upper lip, to the chin. And you can apply as much pressure as you want. We're going to do this for the next 2 minutes. Now, this acupressure point is very good for many different reasons. It can help with headaches. It can help with migraines. It can help with sinusitis. It can help with allergies. It can also help with acid reflux, nausea, diarrhea, constipations. Ladies, it can help you with reproduction. Gentlemen, it can also help you with reproduction. It can also help with ED and PE issues. This part of the body also represents the spine. As we stimulate the spine, we are bringing blood flow to the spinal cord, and then the spinal cord can work more optimally so that the organs get nourished. And as the organs get nourished, then the body can work in a greater fashion so that there are more resources to help you to lasting longer. This acupressure point can also help balance out thyroid, testosterone, estrogen, progesterone, FSH, and LH. And so as you have more available hormone, then you have more resources to helping you lasting longer. As you are sitting in this position, in this asana, doing this acupressure point, you can also double and triple the effect by imagining blood circulating from the top of your head through the neck, through the spine, to the hips, to the pelvic floor. This will create a triple effect between the asana, the acupressure, and also the spine to help you to have greater blood flow to the pelvic floor. As blood flow gets pulled to the pelvic floor, it nourishes that area, and as it nourishes that area, then it tones that area, and as you have tone in a muscle group, then you have greater control, which will allow you to last longer in the bedroom, both for men and women. Now, I want to include an asana that can also help with the pelvic floor. We're going to do the yogi squat, and after that, we're going to do another asana coupled with an acupressure point. So with that, let's go ahead and stand. And then we're going to feet shoulder length apart. And then we're going to do prayer hands, and then we're going to also squat down. And we're going to hold this asana for about 2 minutes. If you can only hold it for 30 seconds, that's okay. Do as long as you can. I love this asana. This is such a powerful asana that can really help with many different things. And you've seen me do this asana now a few times. And one of the reasons why I do it a few times is that if you can also get in the habit of doing this, this can help you to have not only focus and also greater blood flow to the pelvic floor, but you'll see many different health benefits. A lot of times with the yoga, it helps you to focus the body to focus the mind. And if you can focus the mind, then you can do anything. And I am doing my very best to give you combinations that can not only help you with your bedroom needs, but can also help you put you in a better state of being. And if you're in a better state of being, then your body doesn't produce as much cortisol, and you have more available hormone to help you in many aspects of your life, including the bedroom. It has this beautiful flow, and I'm doing my best to set you up for success in that manner. And as you're doing this, I want you to also consider some of the lifestyle changes that we have talked to you about, such as getting enough rest, 7 to 8 hours of sleep, and also getting some of the food habits in place to help you along the way. We have talked to you about so many different foods. We've talked to you about cinnamon tea, turmeric and ginger tea. We talked about garlic. We've talked about pomegranate. We've talked to you about green leafy vegetables, avocados, bananas, spinach. We've talked about walnuts and nuts and almonds. We've also talked about shellfish such as tuna, as well as sardines. We've also talked to you about many other things. So do your very best to consider eating those items into your diet so that you can set your body up for the best environment to last longer in the bedroom. Now, the last asana is a very nice asana, and we're going to compile it with another asana as well as an acupressure point. So this one, again, feet firmly on the ground. And then we're also, if you can, we're also going to fasciculate the knees just in this manner. And we're going to do an acupressure point along with it that can greatly help improve blood flow. Now, for blood flow and blood pressure needs, please talk to your physician, as they have the training to help you. But there are some really good things that you can do to help manage and work alongside your doctor. An acupressure point that can help moderate blood flow. Now, why is moderating blood flow very important? It is important because if you have more available blood flow, then you have extra resources for it to nourish the pelvic floor, which will help you to last longer in the bedroom. The acupressure point that I have seen great results with in clinic is from pretty much the midline of the body, where you have the third eye, above the eyebrows to the temple, along the jawline, all the way back up towards the eyes. So we are going to do this asana and this acupressure point for the next couple of minutes, so follow along. And if you're struggling with blood pressure, I do see a correlation in the clinic where patients, gentlemen, especially with blood pressure issues, they have trouble with items such as PE and ED issues. Now, if you're one of these gentlemen, do work with your physician so he or she can help you. But things that you can do is the asanas, this acupressure, and also you can also consider drinking cinnamon tea. You can do up to 4 cups a day. Work with your physician on the number of tea cups that you can drink daily. You can also incorporate hibiscus tea into your diet. You can also incorporate a clove or two of garlic into your diet daily. These are just simple home remedies that can help you along with the recommendations of your doctor. And again, the reason why blood flow is so important is that if you have a deficiency of blood flow, or the blood is not moderating in the best way possible, then it's not going to be able to function in the way that you would like optimally in the pelvic floor, which means that you may not have the results that you want in the bedroom for both men and women. And just a few other little reminders: always work with your physician and have a good relationship with him or her. Please do that for me, and anything he or she says supersedes what we discuss here, because they are going to examine you and they'll know firsthand how to help you. In addition to that, if you go to the course description right below, you'll see an email address. Send me your email and I'll send you some diet therapy tips as well as acupressure and asana tips that you can follow along and have written notes. And that will be very good for you as well. What I'd like for you to do is, before we meet up tomorrow, I want you to go through the sequences we have presented and pick a sequence or two and do them 2 more times before we meet up tomorrow. I'm doing my very best to get you into a therapy of doing the acupressure, asanas, and diet therapy daily. And if you do it consistently, you'll see results. Most patients and followers report back to me, they see results within a couple of weeks to a couple of months. You'll know when to stop, but stay consistent with it. And I'm here to encourage you along your way. Be well, and I will see you here tomorrow.